Former president of Doctors Nova Scotia, Dr. Colin Audain, explained, ideally what we'd like to see is attachment to primary care providers, and that's not what Maple provides. Last year, there were 48 doctors working for this government Maple vendor, a for-profit company's app. How many of those doctors left their practices and rosters to work for this government's app?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So certainly the option for Virtual Care Nova Scotia that's offered through Nova Scotia Health and through Department of Health and Wellness is a publicly funded system. So those physicians are remunerated as they would be if they were in any other type of practice. Physicians are independent practitioners, and they are able to choose the type of work that they do and where they work. We certainly aren't in a position to limit that. So Virtual Care Nova Scotia is a publicly funded system, and so the physicians or nurse practitioners who offer services are paid by the public. Thank you.
I recognize the Honourable Member for Halifax Armdale.
Madam Speaker, as we enter the weekend, Nova Scotia Health website shows their emergency room closures in Spring Hill, Pugwash, Liverpool, Canso, Sheet Harbour, while everyone else knows other emergency departments are operating day to day. My question is to the Minister, what's the plan to provide emergency services to rural Nova Scotia? Not next year, but next week, next weekend.
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So certainly, we understand that there is workforce shortages in relation to the emergency departments across the province, but there are a few things that are happening. Certainly, we work in communities within existing resources to see what availability is there for individuals who are trained and competent to work in emergency departments based on the level of emergency department that is in each community. We are looking at in-market places to recruit people who are emergency department trained, like South Africa as an example, who have a similar skill set to the requirements here in Nova Scotia, very well trained physicians. And certainly I want people to know that when they call 911, if they're in an emergency situation, they get care immediately. The dispatchers can attach them to care in the medical comm center.